Doctors have broken a number of barriers in the treatment of breast cancer in the past few years. The treatments are now tailor-made for those afflicted with breast cancer. One local oncologist believes less is more with the same outcome. It's called the Oncotype DX breast cancer test. It examines the activity of 21 genes in a patient's breast tumor tissue. It reveals information for tailoring treatment based on the biology of the person and the disease. Doctors Hospital at Renaissance oncologist Dr. Eugenio Galindo says this will determine if a breast cancer patient needs chemotherapy or not.
So when we do this genome testing to a patient, I tell them, look, hormonal therapy is good for you. The pill is going to cure you. You have the probability of 99 percentile of being free of cancer if you take only the pill. The chemo would not do any benefit for you.
Dr. Galindo says there are so many other benefits to this type of genome testing, and that includes not having to always get a mastectomy if diagnosed with breast cancer.
Now, the complete mastectomy has no benefit in most of our patients. Now we can provide maybe less chemo to a patient. Now we can provide maybe less radiation therapy to a patient, more localized therapy, less time period, instead of 6 weeks, 3 weeks, maybe only 5 days radiation therapy instead of the 6 weeks.
Dr. Galindo tells us this tailor-made treatment is now here in the Valley, and there's no need to travel to a bigger city.
So instead of patients going out to Houston, look, I came from MD Anderson, right here. We're going to have it here. There is no need to go to Houston or go to San Antonio, other places, because we can provide that services here to our community.
So the breast cancer patients of today now have more choices when it comes to treatments.
So patient comes in and we do the full assessment, the adequate assessment that requires for a patient breast cancer. And depending on that assessment, we do now less surgery, less chemo, less side effects from patients, and we optimize the results, which were equal or better than what it was before.
And by this time next year, DHR will have a state-of-the-art breast cancer center of excellence located in Edinburgh.